In this segment, I want to talk about medicine delivery using the feeding tube. Assuming a normal situation, the PALS is going to be taking a lot of pills. If at all possible, one of the things that you can investigate with your pharmacist is if the medicine is available in liquid form. And obviously, if you can get it in liquid form, that's helpful from a feeding tube standpoint. If the medicine that the PAL needs to take is in pill form, you're going to need a pill crusher because you're going to need to crush all these pills all the time to get them mixed with water in order to get them through the feeding tube. Now what I found is, number one, make sure you get a good pill crusher. You're going to be crushing a lot of pills over a lot of period of time. And I first started out with a cheap little pill crusher, and it wore out and was difficult to use very quickly. So, the difference between a $5 pill crusher and a $15 pill crusher is really significant. So get the more expensive one. Get one that you're going to be working with and it'll work well for a long period of time. When you crush the pills, you have to, after you have them crushed, they need to be mixed with water. So what I did is I took an old aspirin bottle or an old medicine bottle. I don't mean a prescription medicine bottle. I mean an over-the-counter medicine bottle that had a screw cap on it. Has to have a screw cap. And what I did is I would take the crushed pill material, pour it into the bottle, and then I would add water, and then I would put the cap on and shake it up. And that way I mix the pills, crushed pills, with water, which I then could put through the feeding tube. And when you go to the hospital, I saw this a number of times. You saw the nurses putting the pills in a small cup and swirling it with a stick. Well, obviously that doesn't mix it up very well, even after it's been crushed. So I found that my approach, which I showed some people and they thought was really worthwhile, was to take a small bottle again with a screw cap, put the crushed pill in, put the water in, and then seal it up and then shake it. And then of course I would thoroughly clean the shaker bottle out with hot water and let it drain out so that it was clean, perfectly clean for the next time I wanted to use it. The other thing to do is all the medicine that the PALS is taking, all the actual pharmaceutical containers, keep them all in a black plastic tray where you're going to need them. And then have a white plastic tray next to it so that when you take a pill bottle out and you open it up and you take some pills out and put them into the crusher and you seal the bottle, you then put that container into the white plastic tray so that you know you've done that one. And then you can do the next one. And then when you're all through, then you can move them all back from the white container back to the black container. But initially I found I just had them on the table, and the question became, did I use that one? Did I crush that pill or didn't I crush that pill? And if you got interrupted with a phone call in between or something happened and then you came back, you couldn't remember which ones you used and which ones you didn't. So it's very simple. Just take a small white plastic tray and a small black plastic tray and just keep transferring it between the two so that you know which ones you've used and which ones you haven't.